You ever looked at yourself in the mirror and just felt like, who is this old person looking back at me? My patients come in and tell me things like that all the time. They just don't look the way that they feel. They might be eating right, they might be working out, and they just still feel just like they look old. So one of the most transformative things that I can do is a deep plane face and neck lift. This is a procedure where I am basically taking things like saggy jowls and saggy neck down here and repositioning everything back up to where it used to be. This is one of my favorite procedures to do because it's such a transformative thing and the anatomy is beautiful. Now, what I'm basically doing is I do make incisions in front of the hair and around the ears, and what I'm doing is I'm getting down here where I can reposition those muscles and get things back up. Now, a deep plane approach is what I do, which we can get into that, but really just in terms of what I want to accomplish with this video is just to show you what that actually looks like. People are often worried about looking pulled or just something looking off or unnatural after surgery. And what you're going to see with my results is that they just look awesome. They just look like a more refreshed version of themselves. So we're going to go through each of these examples to really show you why this procedure is one of my favorite procedures to do and why a deep plane face and neck lift might be something that you could benefit from as well. In this first example, what you're going to see here is that she just looks like her face is droopy. All the skin is coming down, her neck is kind of collecting all that skin. And so what we did is a deep plane face and neck lift. You can see she's got some upper eyelid hooding. I also did an upper eyelid blepharoplasty. And when we put all those procedures together, you can see that we took like 10 years off her face. She looks awesome. And it's one of these things where once people are healed up from this, which is usually the first couple of weeks after surgery, they just feel and look like a different person. They have such renewed confidence and they feel great. And that's really awesome for me. I love that, and it really just, that's what gets me going in the morning. And so with this patient, you can see that she's got much better cheeks afterwards, the jawline is improved, and the neck is much, much better. So this is really cool. This is a great example of all the things that I can do together. Little tweaks here and there are what make for a really transformative result like this. Now with this next patient, what I want to show you is that a lot of people say things like, well, aren't I too young for a facelift? I think what we're seeing is that patients at a younger and younger age are just getting more comfortable with the idea that, you know what, I just don't like this fullness or this laxity here and I just want to do something about it. And they're getting facelifts sooner. And so this is a patient that didn't need a facelift. I mean, nobody needs a facelift, but when she does, it looks awesome, and you can see what it does. She was particularly bothered by the jawline laxity, the jowling that she was starting to get. And this loose skin here just gets tucked up and looks super natural, and she looks super refreshed. So the neck looks better, the jawline looks better, everything looks natural. So it's really just a younger version of you. We're just basically turning back the clock. Finally, what I want to show you with this one is that some people have really full necks and they might be born like this. So this particular patient, super active and still kind of had this like fullness down here. So what we did was a deep plane face and neck lift, as well as a deep neck lift to really recontour the structures in her neck. When I do a deep neck lift, what I'm doing is I'm actually removing some tissues here under direct visualization, meaning I can see what I'm doing. With something like lipo, you're just kind of sucking out a little bit of fat here along the skin surface. I'm not able to get deep to those muscles. And below those muscles that you can see, there are really important things. The submandibular gland is there, other muscles down here, and I'm really having to recontour all of those things to get the appearance that we're looking for. And so sometimes I do both a facelift and a deep neck lift to get this kind of result. And so for her, this is exactly what we did. I removed quite a bit of tissue down here to create space to make a good neck angle like that. And then when you put it all together, she just looks like a younger version of herself, super refreshed, super awesome. She was crying tears of joy when I saw her afterwards, and I was super excited for her too. It looks great. My name is Dr. Peter Vila, and I'm a facial plastic surgeon, and maybe in another video I can explain what a deep plane approach is and how that works, but for now I just want you to see some real results to see what we can actually accomplish with this incredible surgery. Yes, it's a recovery. Yes, it's a process. That's why we talk about everything first and we know what you're getting into. If you want to come talk to me about it, I would love to talk to you about it. Check out my website. You can set up a consultation there, and I will see you on the next video.